welcome back. I'm your host, Michael Stamatinos with the Advancing Healthcare Innovation Show. And if you're new to us, we're super excited to have you here. We also happen to be extremely passionate about healthcare innovation, adoption, access to care, and leadership. And so if this is your first time tuning in, let me just tell you a little bit about what we do here. So we're a healthcare innovation company. We're focused on bringing stories of innovation within healthcare to life. And our aim is actually highlighting real people that are truly innovating within our space, and we give them the platform to be able to share their stories with the world. And look, we've got an incredibly action-packed year planned with some amazing new content, some incredible interviews that are upcoming. But if you haven't, check out some of the historical ones and hit subscribe now to consume the content and just make sure that it comes to you on a regular basis. I'm just really, really floored and delighted that we have this guest coming on today, Dr. Susan Schayes. She's the Chief Transformation Officer for ChenMed, one of the most successful full risk Medicare Advantage providers in the nation. And they were recently voted for the second year in a row, announced that they were the #1 most loved healthcare company in the US. And Dr. Schayes was also honored as a top 50 women's leaders in the state of Georgia. Dr. Schayes, welcome to the show.
Thanks so much. I'm excited to be here, Michael. And there's so many different exciting things to talk about in our journey here together. So love to be able to share.
Yeah, so let's start with that because your journey started being in academia for a number of years, and I'm curious if you wouldn't mind maybe sharing a little bit of your story. What was it that lured you out of that particular environment into the environment that you're in now?
Yeah, great question. I worked at Emory University, which is an amazing, top 20 academic university, and was the division chief there for family medicine, as well as the residency program director. And I studied these models of care, which we call patient-centered medical home models. And I came across ChenMed, and it really seemed too good to be true. And so I had the opportunity to actually go to Richmond and Virginia and spend some time with the chief medical officer at that time, and then be able to fly to Miami and spend some time with the Chens and spend time with Gordon and with Chris Chen and with Jessica Chen and really see their model. And after that, I flew home. I couldn't sleep for 2 nights. I told my husband, my people, I found my people, and I'm going to leave my academic job and be able to help transform American healthcare. And really, at that time, a lot of people had theoretical ways of looking at how they could change, but they weren't actually doing it, bricks and mortar. And what I found was ChenMed and the Chens had really been doing this successfully for many, many years. And it was the first company, organization, anybody that I thought could actually transform American healthcare. And I wanted to be part of that journey. I wanted to be part of that because fee-for-service medicine really had started its death spiral and really was going to be, archaic and obsolete for the future. And I didn't want to continue on that journey in an organization and with a system that was inherently flawed, broken, and not going to be sustainable for the future.
Wow. So I know you've spent a bit of time now at ChenMed, and that feeling that you got when you first sort of sat down and made that decision. Do you still have that same fire? Do you still have that same burn? Has it plateaued,
I
or does
do.
it still grow?
I do, absolutely. Every day I get up with sort of this renewed inspiration. And I think that, so many people in healthcare are really dismayed. Over the last 3 years, COVID has been an incredibly emotionally and physically demanding time for healthcare providers. And everyone in this space is really looking for meaning and purpose in their life. And they're looking for something where everybody wins. And what I found really disheartening in healthcare was a lot of the systems and the way it's set up, especially fee-for-service medicine. Someone has to win, well, someone has to lose. And in this value-based sort of next gen, which we call transformational care, everyone actually wins. The patients win, society wins, the health plans win, ChenMed wins, the communities win, my family wins, everyone around me, anyone in contact with our system actually wins. And there isn't a single other system that allows that to happen. And at the end of the day, the patients get a better outcome. We get better health at a lower cost. Who doesn't want that? Who doesn't want to have their grandmother or grandfather live longer, have better quality of life, and be able to do the things that they want to do that are meaningful and impactful to them as a person.
Yeah, I mean, what you just said there's so much to unpack, and I feel the energy, I feel the excitement and the enthusiasm. How do you get that level of enthusiasm to transmit across the entire organization? Because you could be a gang of one, but to be listed as the number one most loved healthcare company in the US, not just once, twice, 2 years in a row, especially during the last 36 months have been pretty rough on healthcare as a whole. How does that happen?
The magic sauce you mentioned there, because we're the most loved company, is actually part of our values, which are love, accountability, and passion. So let me unpack that a little bit for you. The
Yeah.
first one is love. So we actually define that and within our organization, and we love on each other and love on the physicians and love on the staff and treat each other like family so that we can love on our patients. And in healthcare, that's really unheard of, to be able to do that and invest and help people get to the next level and have an inverted pyramid system where we expect everyone to do better, where we expect people to get new tools and skills and be able to be promoted within the organization. And we're all in it together to help each of us rise up within these communities that we serve. And about 85% of our employees are from the communities that we're serving, which are underserved communities throughout North America, throughout the United States. They're the poorest, sickest, and neediest communities. And so that's really unheard of in healthcare. And accountability. So we're accountable for outcomes as opposed to fee-for-service medicine. It's transactionary, it's episodic, it's very fragmented and broken. This is about continuity. This is about longevity. This is about relationships and trust with your patients and getting to know people as people and bringing that doctor-patient relationship and that humanity, which really makes your job fun, interesting, and exciting, happy, fulfilling, to the forefront. And then a passion. So that's, we show that in our everyday activities. I mean, at ChenMed, I give everybody a hug. So you get a hug when you greet people, you get a hug when you're leaving, and patients, I get a hug when I see them in the morning, and when they finish their appointment, they get a hug. So we express our passion and our love and our accountability, and we're free and able to do that in all sorts of meaningful ways. And during COVID, gosh, we were delivering toilet paper, we were bringing food to the homes of our patients. We developed COVID kits that we were able to publish, that it saved lives, and we brought resources to patients because we thought they were the best things to do and the best way to help people in society, not because we could bill for it, because it actually made a difference and saved lives.
So I like how you mentioned how the people that are working at the clinics are often the ones that are living within the community. And is that something that is very strategic, very important to make sure that you are embedding yourselves within the community? What's sort of the thought behind that?
Absolutely. So when we come into these underserved communities, we don't want to come as an outsider in. We want to come as an insider within the organization and within that community. And so a lot of the folks that work within our communities, like I said, 85% of our employees are from the communities we serve. They have a lot of information about that community. They have a lot of knowledge about that community and about the needs of the community and the people in that community. And quite honestly, some of the patients are their, uncle, their aunt, their mom, their dad. So they're serving people, or a neighbor that they've known for 40 years. So these are people that they're serving within their community. It brings a real strength and diversity to our workforce, and it also enables us to help transform these communities. So traditionally, when we go into these communities, we rejuvenate space. So we'll take an old strip mall or another space that perhaps hasn't been used for a number of years, that might be an eyesore in the community. We transform it into these beautiful beacons of hope and light on the hill that allow this world-class healthcare to happen in their neighborhood for the seniors. And then we bring jobs to that community. And so we hire people from those communities to help make that difference and help empower that community and help bring social justice and health equity to these underserved communities and help folks within these organizations be able to get these positions and be able to move forward. One of my proudest moments within the company is we had an employee who started out as a part-time housekeeper, so environmental services, which is an entry-level position within our organization. And fast forward 5 years later, she is standing on a national stage, winning a national award for our company as a center director. And that's just an
Wow.
absolute testament to this organization and company, because that's what we want to do. We want to be able to help these communities thrive, not just survive. And that means empowering the employees and empowering the community and really, helping everyone that has the opportunity to touch ChenMed to be able to do better.
So there's a lot of underserved, overlooked areas throughout the country. How how do you select what areas, what markets you go into? Is there a recipe behind that? To what degree are you able that you're able to answer? Obviously, this is maybe part of your secret formula, but to whatever degree you're able to share and shine some light on that, that'd be great.
Yeah, absolutely. So traditionally, we go to the most underserved and neediest areas, and a lot of times those are actually in large urban areas, but they're also in rural areas as well. And so we do healthcare mapping to look at how many people live in that area and how many underserved people are in that area. And there's a lot of data that's available. I have a master's in public health as well, and we have a lot of people that look at population health and are able to sort of look at where that population is. Where are the neediest populations? Where are the people that have the least ability to access services and have really huge access issues? And where are the healthcare deserts? So those are the areas that we're looking at. And unfortunately, a lot of large healthcare organizations have retracted or left these areas. I was talking about Atlanta, which is where I live, and our centers are in health shortage professional areas that are designated by the government that are health shortage areas, and they're medically underserved. And so those are the areas that we go to, the neediest areas based on data and information. And then we also are able to get some other statistical information that helps to correlate that to make sure that is correct.
So when it comes to recruiting physicians, it's very clear to me that you've built something that is not just near term. This is a long lasting, mission that you guys are about. To what degree does that actually play in the recruitment process? And there's a lot of talk and banter about there being a shortage of primary care physicians. How have you guys tackled that problem? And is that sort of still something that you guys are grappling with as well in terms of finding talent, bringing in talent?
Absolutely. So there definitely is a shortage of primary care physicians across the United States, and it is difficult to recruit physicians to most areas within the United States. The difference with ChenMed is we're physician-led and run, and so we have an incredible ability to be able to help clinicians become the leaders that they want to, or to become a really great primary care physician within a collegial, collaborative, cooperative environment. And burnout is a huge issue for physicians. We mentioned COVID being a huge issue and being incredibly difficult. And people leaving the workforce, whether it's in medicine or other professions, we've been having a wave of that because of some of the inherent, challenges within that work
Right.
environment. During COVID, we also had a lot of physicians who were furloughed, doors were closed, people were unable to continue their business. And so, a number of physicians were able to come to our organization during COVID looking for that transition and looking for a successful model that wasn't based on volume and wasn't based on, RVUs, and that was going to be sustainable for the future. And unfortunately, COVID helped them make that decision sooner than later. What's really wonderful is as we continue to grow in this organization, the accolades just continue. And we have won, a huge number of awards for being the best company in the United States in multiple different sort of areas and arenas. And there's just like a page of accolades from 2022 that really allows people to get a visibility of who we are and what we do and the culture within our organization. And people say, I want to be part of that. I want to be part of that mission of transforming healthcare. I want to be part of that mission of making a difference every day and having meaning and purpose in my life. I want to be in a position where I have opportunity and I can grow and I can be challenged. I want to work with like-minded physicians and coworkers that it's a happy, fun, empowering environment where I can continue to thrive. And when they look at all of those pieces and variables, there's very few companies that offer that. And so I think that our value proposition in terms of that is really, really compelling to physicians. And to actually have people pour resources and education and learning and teaching and training into physicians is really, really amazing, because that stops when you finish residency and that stops when you finish fellowship. And then,
Sure.
we launched just recently this best-in-class, absolutely groundbreaking fellowship in transformative care, which will allow clinical physicians who are primary care physicians to really be able to get the tools and resources and skill sets that they need to be clinical leaders for the future. And I'm the program director for that program.
So let's break that down a little bit, because it seems to me that if there's any, secret sauce that you guys have, is that you're a really good builder of other leaders. And people want to be a part of something rather than have nothing to be a part of. That's just, that's fact. And when it comes to grooming clinicians for the next level, sometimes the best clinicians don't make the best leaders. What was that straw that broke the camel's back that made you and the rest of the leadership team think that this is a gap that we need to address? What can you maybe take me through that?
So I have to kind of take it back a little bit and start with the 10 years I've been at ChenMed. And so one of my
Okay.
expertise is in graduate medical education and training physicians. And so some of that expertise, along with a lot of other gifted physicians, came to the company, and we're really able to set up systems over years to really train our own physicians to be able to be outcomes-based and value-based care physicians. But to be able to transform healthcare for the future, you really need to have clinical leaders. And it's a catch-22. So people say, I want to be a leader. And then they apply for a position that says, what leadership
Right.
experience do you have? And they're like, I don't have any. Well, we're looking for clinical leaders with leadership experience. Well, they can't get the leadership experience, so that they can never get a leadership position because it requires the experience. So this opens an opportunity that didn't exist because it's fully funded at a market level. So the barrier for, hey, I can't go back and do residency paid position because I have a student loan and I have my mortgage payment and I'm, pretty established. I have to be able to support myself, and I can't do that if I go back and do a fellowship. We've really just eliminated a lot of those economic barriers that physicians have, and then put together over many, many years, a structured educational format for our PCPs as well as our clinical leaders within the organization, and then be able to get to the next level as we've really built out what's called transformational care, which is next gen of value-based care, to be able to bring in external providers and be able to fast track them in a 2-year structured elite clinical program that's deliberately difficult and intensive, and be able
Wow.
to at the end have them as clinical leaders within our organization. So it's groundbreaking, but it didn't happen overnight. It's happened over many, many years to develop the infrastructure for those other things, and then to be able to have the commitment from the leaders in our company, Dr. Gordon Chen and Dr. Chris Chen, to be able to transform healthcare. You have to produce leaders.
Yeah. It can't be done alone. You have to produce a gang of them. How many of those folks are going through the fellowship program on an annual basis? And is it sort of a rolling admission? What's sort of the context around that?
Great question. So it is a rolling admission. Traditionally, fellowship programs are usually starting in an academic year, which is in July, but this is a rolling start. So instead of, hey, I have to wait a year to start the fellowship, it's a rolling start. And we have our first fellow who has just started in our program last week. So we're up and running. We've
Nice.
hired our second fellow. We've interviewed, we've had 50 folks apply to our fellowship program, and we've been interviewing candidates. We're highly selective. And so we're looking for really special people to be able to join this, accelerate their career in this intense, very structured learning program with a lot of the coaching, mentoring, and didactic as well as experiential learning that people really need to be successful.
And is there like a program that exists like that for people that are coming in that are, let's just call it, not as skilled as a physician, maybe even nurses, nurse practitioners, other mid-level practitioners? What's maybe the thinking behind that as well?
Yeah, great question. So within the organization, we have a lot of training programs, and actually we welcome highly skilled nurse practitioners to come and work in our company, as well as primary care physicians, internal medicine, family medicine, as well as geriatrics. And so we have clinical pathways for them to be able to move up into partnership and various levels depending on meeting these performance expectations, being able to be really an outcomes driven physician and change the outcomes of their individual patients, but also their portfolio of patients and then the community's health. And so you can have that pathway, or you can have a clinical leadership pathway within the organization. It's up to you. And one of the great things about ChenMed, and you know, this year our CEO won an award for being one of the best CEOs in the country for women, is we have a large number of women in our organization, and women physicians, and women in leadership within the organization as well. And so I'm very proud of ChenMed being a leader in that area, in that arena.
It's pretty fantastic. Are there other areas that you feel like that there is even more opportunity for you guys to innovate in going into this year and the years ahead? And how far out are you thinking when it comes to planning, seeing around the curve? I mean, can you
Yeah,
give
that's
us
a
a
great
little bit of
question.
a glance into that?
So at the end of this decade, we really want to be transforming healthcare in the United States. And we've really put a stake in the ground to be able to do that. And I think that ChenMed's been doing this for 35 years, so they're certainly very far ahead. And there's a number of areas that allow us to really accelerate when other people aren't able to do that. One is to have the clinical leaders and have people within our organization that have been with the organization. I've been there 10 years, 15, 20 years, 17 years. And Dr. Gordon and Dr. Chris Chen and Dr. Jessica Chen, who have been with the organization for a long period of time as well. And then the founder, Dr. James Chen, as well. So there's this longevity and sustainability within the leadership team that continues to bring on the next generation and the next generation of clinical leaders within the organization. You don't necessarily find that, the physician led. You don't find the tenacity to teach and train and invest and coach in others to get people to be at the next level. You don't see the tenacity to hire people that you are going to pour into just like a family member, and you're going to love on them and help them get to the next level. You don't find that within other organizations. The mentoring, the coaching, the advising, and that commitment level. And then at the end of the day, you don't have opportunity for the long term. And we're in hypergrowth. Our company continues to grow. We have more than 100 centers in 15 different states. Our growth rate is more than 30% a year. So we are continuing to grow, and there is an inordinate amount of opportunity and ability to continue to elevate your career continuously within the organization. I've probably had 9 titles since I started in the company, and I've been here 10 years. The Chief Transformation Officer, I've been just a little over 2 years in that position. That's probably the longest I've had a title for.
So when you think about, I guess as the company continues to grow and evolve, and I liked how you mentioned you said a word, sustainable. So you find bases that you can transform. What about, there's been a lot of talk around care that happens outside of the 4 walls of a clinic, care at a distance, virtual care. Where does ChenMed fall within that sandbox? How do you view it? How do you use it?
Yes, that's a great question. I think that COVID forced us to be able to be creative. And, we switched basically in 3 days over to 80 to 90% virtual. And that allowed us
Three
to
days?
continue in three days. We have our own technology company. We have our own proprietary software. We have an ability to be able to do that because of the technology we have within the organization, which again, large organizations just shut down and closed their doors for 4 weeks because they didn't know what to do. We could pivot and move to that platform rapidly. We did it in 3 days. And that allowed us to be able to see how this experience actually worked. And again, on an interim basis, there's certain things that we were able to do extremely well, and other things that really required face-to-face interaction. And so, now we have a combination of on-site visits with our patients as well as some of the virtual. But clinical medicine, specifically, a lot of our patients have high-risk diseases, and a large number of high-risk diseases, the large disease burden, they're sick and they need to be seen face to face. You cannot do every component of a history and physical examination. Distally, you need to actually see the patient and develop that relationship. And a lot of our patients, loneliness and social isolation were big issues. And that humanity and meeting people and having fun, and our centers were social centers of activities that happened. And coming back to that and being involved with that, with the exercise programs and the education programs, and seeing other seniors and interacting and playing bingo at the center, and having a card game with your friend. Those are a component of healing and of health. As well as large number of our social determinants of health that we try to be able to assess with our patients and really look outside those four walls. And within our value-based model, we're really responsible for the patient's care, all day long, 24/7, 365. And so coordinating that and being that quarterback that really knows exactly what's going on with the patient's care. So the lessons that we learned with COVID helped us understand what we could and what we couldn't do. And then, obviously during COVID, some of the activities that people did were based on the safety of the center and the safety of the patients. And so we wanted to keep our patients healthy, happy, and at home. And using virtual technology allowed us to do that somewhat. But for specific patients, we still needed to bring them back in and really have hands-on. And I think there's a number of areas that we can excel in virtual. But our model works the best with the patients coming in and that hands-on experience.
So you mentioned earlier about developing proprietary technology. Is that a big aspect? Is there a big technical team within ChenMed, and being able to build and innovate in-house? And at what point do you decide that maybe you go to external innovations and bring them in?
Yeah, absolutely. So there is a wonderful technology company called Curity, which is owned by ChenMed, and provides our technology support. And just an incredible organization, again, award-winning for best places in IT to work, and full of creative, innovative people. So we have our own proprietary a number of applications, as well as our own medical records. And again, medical records are the number one dissatisfier for physicians in the United States. And a lot of them are made by big companies, and they're very difficult to use. They're not designed for primary care. They're designed for hospital billing and coding. And we have just, point of service abilities to look at your quality, abilities to look at things that are screening tests and other things that the patient needs to do, and be able to get a really good snapshot of the patient's health in our view. And a lot of the other electronic medical records don't allow you to be able to do that at all.
Yeah, when you think about physician burden, you think about the complaints, it has a lot to do with the amount of time they're spending inside the EMR and dissatisfaction around and how cumbersome it is. So I guess it's not shocking that physicians that are working at ChenMed are happier, simply because maybe you guys have built something that's keeps the physician at the forefront of everything, being a clinically led company. So again, it's not a surprise to me based on that answer.
So,
So curious.
that's a huge satisfier, having a great electronic medical record system that's end user to end user. So everyone within the organization is a clinical leader that's leading. And so you're a clinician and you're feeding information back to another clinician who understands, how to improve and how to change things. And that feedback loop is not going to someone who's an IT person that doesn't have any clinical knowledge and never seen a patient, doesn't understand why it needs to go this certain way. And so that's very, very powerful as well, end user to end user.
So it seems like then the secret of ChenMed really isn't a secret. It's really lead with your values, live them out, pour into people, continue to grow and develop people, treat people kindly, treat your internal customers well, treat your external customers well. I mean, it's easy. It sounds simple. It's it's not easy to execute when you have 100+ centers across the country. I mean, that alone is very, very impressive. Maybe just kind of closing thoughts. Is there anything that, for those that are tuning in, if there's one thing that maybe any leader that's tuning in can focus in on and execute on, do you have like a golden nugget that they can take away and start, executing on?
I think that I become pretty reflective around the new year, and the new year allows you to sort of reflect: am I where I want to be? Am I doing what I want to do? And do I have that meaning and purpose in my life? If the answer is no, then you need to look and find your people. And so if you're not where you
Yeah,
need to be, look and see who's got your vision, mission, and values that you're looking for, and find your like-minded people. And that's the nugget. If you're a physician, if you're a clinical leader, you have an opportunity to go where healthcare is going. And, I love Wayne Gretzky, the greatest hockey player in the world. But, what made him great was he went to where the puck was going. And value-based care and transformative care, next gen, is where healthcare is going. So don't become the payphone booth repairman who's obsolete and outdated. In New York, the last payphone was removed from New York in 2022. So if you're a payphone repair person, you will no longer have a job. And fee-for-service medicine is the same way. Don't become obsolete and archaic with outdated skills. Look to where it's going, and it's value-based care and next-gen transformative care. Find the people that are doing that and find your tribe.
that's fantastic. Find your tribe. So you guys heard it here. What's the best way for people to follow ChenMed, to follow you? I mean, you're obviously on the speaker circuit, you're out and about, and so is the rest of your leadership team. But how can folks tune in to learn more about ChenMed and the great
Great
work that you
question.
guys are
So
doing now?
www.chenmed.com, our website is a huge amount of information. Fassel and Friends has a great podcast that you can follow, especially with a lot of clinical thought leaders. Additionally, you can follow me on LinkedIn, Susan Schayes. I'm on LinkedIn, and you can just ask to connect directly with me. And then you can follow ChenMed on LinkedIn, which we have a very active account there with a lot of information, especially, wonderful information coming out from our executive team and our clinical and operational leaders. And then, go ahead and get the Chan's book. Gordon and Chris just wrote a book that is a bestseller and also won a national award. And this week was featured in Newsweek, one of the excerpts from the book. So, download it from Amazon.com. It's The Calling, and it will really give you an idea of what it took to form this company and what they're doing that is really different and is going to help us be, cutting edge and lead American transformative care.
Well, fantastic. Well, what we'll do is we'll put those links in the description so that everyone knows where to go, both for the book, both for ChenMed, and also all your social channels and all those things together. So for those that are tuning in, if you found this content helpful for you, would you mind sharing it on social media? Would you mind commenting or just, sharing it with your network? I'm very, very grateful, first and foremost, Dr. Schayes, for you being able to come on today to share your passion, to really just share where your heart is at. And I think it makes a difference when we can have more and more people coming into this type of a community, not just people that want to advance healthcare forward that are thinking about it, those that are actually doing it. So I'm looking forward to, at some point in the future, you have the open invite. You're more than welcome to come in. I probably do see a book in your future sometime in the near future as well, just given all of the things that you're doing. So it's a pleasure having you on, and I'm looking forward to our next conversation.
Thank you, Michael.